So we are in fundamentals, page, what did I say, 487.
Did you already start?
Yeah. I can chop off the.
No, just wanted to make sure.
Yeah, thank you. Now, this one is related to what people would call core function, the abdominal muscles during flexion. And we'll just read through that a little bit. So this is for trunk flexion. And we're talking about first identifying the normal firing pattern of the muscles involved here. And that would be transverse abdominis, the abdominal obliques, which there are two of, and then rectus abdominis. That's the most superficial one. So rectus abdominis is the six-pack muscle, right? Then you have an external oblique, where its fibers run this way to the center. Then you have an internal oblique, and then you have a transverse abdominis. It creates a very cool basket weave over like your guts. Holds everything in. Ideally, how these fire, now here's my simplified rendition of these. It's going to tend to be eliminating one of the things to palpate, and for you to just focus on two things to palpate to start with. You can always return back to the more nuanced way of looking at this. For core function, during trunk flexion, but also during just like stabilizing yourself, what should be more dominant are the big old obliques. Transverse abdominis and both obliques wrap all the way around. Rectus abdominis is here just on the front. So it's there, but it should just be a helper, not a prime mover. And that's ultimately what I'm feeling for when she does a crunch, trunk flexion. Do I feel this central muscle pop up first, or do I feel the lateral side muscles, the big ones that cover the rest of the body, do I feel them kick on first? And that can help me identify how is her core functioning relative to moving the trunk around. And this at least is something that people are paying more attention to in exercise routines. You hear about core stability all the time and everything. Knees up, there we go. And now, just palpate. Don't try to do, if you see people palpate and they're real fancy where they have like, they're palpating one muscle with every finger, I think that's just too much as you're starting out. Worry about palpating one thing with one hand and one thing with the other hand, and work your way through palpating sets of things rather than trying to palpate 3 or 4 things. It's just not worth you're destroying your brain like that. So here, right in the center, and then off to the side. And I just asked you, you're just going to start to do a small crunch like you're sitting up. And I did feel rectus kick on. Now, there are ways to try to inhibit this, but they're uncomfortable. Try to like pinch rectus. Really what's better is to help a person better train how to affect this better, which is like just drawing. It's not like sucking the belly in. It's the hard part to, but it's like you kind of pre-contract. So it feels like you pull your belly button in a little bit like you're starting to exhale. So you want to kind of just pull your belly in like you're starting to exhale. Now start to crunch. Better. Again, much better. So training people to be a bit more aware of how to do this. Kind of pulling it in. I'll try to exaggerate. Look, here's my belly button. Pull in, and then do the movement. That's how to appropriately, and then for them, palpation-wise, I can draw their attention to it, saying, okay, you feel here where I'm pushing, and you feel here where I'm pushing. Now start to do the crunch. We want to feel these lower obliques kick on more. I'd rather draw their awareness to it so that they can try to interface with this in the future. That's usually what I've done with core stuff. If they have something going on, especially related to low back dysfunction, one thing worth checking is how's their core functioning. This would facilitate probably better at the end of the session. Or the better way, honestly, to do this would be in your initial big assessment session, to have somebody start out, palpate these, and identify how things are functioning, and then get to the massage. And then you could palpate them again and see how much they shifted. That's the appropriate way to do it. I'm aware that sometimes that's hard to package in time-wise, but ideally that would be what you do. Palpate these, even over clothing, then do the massage, palpate them again, see if they changed. And if they didn't from the general massage, then you know to get more targeted the next time.